Hey there, and welcome. Today, we're going to dive into a health topic that affects literally millions of people, and a lot of them don't even know it. We're talking about high blood pressure, also known as hypertension. It's a really big deal for our long-term health, so we're going to break it all down and make it super simple and clear for you. So, what's the deal with high blood pressure that makes it so tricky? Well, you usually can't feel it. There are often no warning signs, no symptoms, nothing. That's exactly why it's earned the nickname the silent condition. And that means you could have it for years and have no idea while it's quietly impacting your health.
And that, of course, brings us to the most important question of all. If you can't feel it, why is it so absolutely critical that we manage it? Well, because the dangers of just letting it go untreated. They're really serious.
So first up, let's talk about that silent risk and exactly why getting treatment matters so much.
I want you to think of that constant high pressure as something that's damaging the pipes in your body day in and day out. Over time, that damage is what leads to these major health risks. It can weaken the vessels in your brain, which could lead to a stroke. It can make your heart work way too hard, leading to heart disease and heart attacks. It can even mess with the tiny, delicate filters in your kidneys. But here's the crucial takeaway. Getting your blood pressure down significantly lowers these risks.
Okay, so let's break it down a bit. What exactly are those blood pressure numbers that we always hear about? It's not as complicated as it sounds, I promise. Imagine your arteries are like a garden hose. Blood pressure is really just the force of the blood pushing against the walls of that hose as it flows through. Now, when that pressure gets too high, your heart has to pump way harder. It's working overtime just to get blood where it needs to go. And that puts a constant strain on those artery walls.
So when you get a reading, you always get two numbers. The top number, that's the systolic, it's the pressure when your heart actually contracts to pump blood out. And the bottom number, the diastolic, that's the pressure when your heart relaxes between beats. Both of them are super important clues to your health. And some people just have a higher risk of these numbers creeping up, often because of things like age, a family history of hypertension, or other conditions like diabetes.
Okay, now for the good part. Let's talk about taking action. Because while the risks are serious, the good news is that you have a ton of control here. The choices you make every single day can have a huge impact.
And we can really boil it down to these 4 key lifestyle changes. These aren't just suggestions. They are powerful, proven steps that can directly lower your blood pressure and boost your overall health.
Let's look a little closer. For activity, it's all about consistency. Just try to get moving every single day. For salt, the big secret is to watch out for the hidden salt in processed foods. You'd be shocked. Reading labels makes a world of difference. When it comes to alcohol, moderation is the name of the game. And finally, if you smoke, quitting is pretty much the single greatest gift you can give your heart.
Now, beyond those general habits, what you put on your plate is absolutely critical. In fact, there's a specific eating plan that's been proven to help manage blood pressure. It's called the DASH plan.
DASH actually stands for Dietary Approaches to Stop Hypertension. And look, this is not some crazy fad diet. It's a flexible, balanced, lifelong way of eating. It's so well respected that U.S. News & World Report has named it one of the absolute best diets for heart health year after year.
So, what does it actually look like? It's pretty simple, really. You focus on adding more of the good stuff. We're talking fruits, vegetables, whole grains, and lean proteins. And at the same time, you just consciously cut back on things that are high in saturated fat and sugar, like fatty meats, sugary drinks, and all those sweets.
And here's just a sample of what that balance looks like. And just look at the huge emphasis on fruits and vegetables. We're talking 4 to 5 servings of each every single day. See? It's less about restriction and so much more about filling your plate with an abundance of really healthy, great-tasting foods.
Now, lifestyle changes are absolutely the foundation of any treatment plan, but sometimes they just aren't enough on their own to get your numbers into a safe zone. And that's when medication becomes an incredibly important and effective tool in your toolbox.
It's really common to need medication. And here's something important to know. A lot of the time, taking a low dose of 2 different medicines is actually more effective and has fewer side effects than taking a really high dose of just one. It's all about finding that perfect combination for your body.
There are many different types of blood pressure meds, and they all work in slightly different ways. Your doctor's going to choose the best one to start with based on things like your age and your overall health. The goal is always the same. Find what works best for you with the fewest possible side effects.
Of course, like any medication, side effects are possible. For example, a dry, irritating cough can happen with one type of medicine. But the most important thing to remember is this: you have options.
If one medication doesn't quite agree with you, don't just stop taking it. Talk to your doctor, because there is almost always another one you can try that will work better. And I want to leave you with this really hopeful takeaway. For some people who really stick with those healthy lifestyle changes and keep their blood pressure under control for a few years, it can sometimes be possible to lower or even stop their medication entirely. Of course, that's always with the doctor's guidance. But what a powerful motivator for making those healthy changes stick, right?
So where do you start with all this? Just remember, this isn't about being perfect overnight. It's all about making small, consistent progress. So my question for you is this: what's one small change you can start today? Maybe it's just taking a short walk after dinner, or choosing water instead of soda with your lunch. Whatever it is, you should know that every single small step you take makes a huge difference. Thanks for tuning in.